there's one thing that is beyond dispute: it simply would not exist if not for the vision and passion of the minister. It was her idea when she first came into the ministry a few years ago now to establish something like this, and the success we've had and the momentum that is starting to build up around this, and the great vibe that it has in the medical devices industry is in a large part due to her work. So it's great to have her here tonight to reflect on this year's round of funding and the broader state of medical technology in New South Wales. Please, the Honourable Jillian Skinner, ladies and gentlemen.
Thank you very much, Adam, and I'd like to acknowledge the traditional custodians of the land upon which we meet and pay my respect to elders past and present, and thank you again, Uncle Chicka, for that very warm welcome. He does it so very well. I wish to acknowledge all of the special people in the room today, Professor Mary O'Kane, who leads a wonderful team, who have been our expert panel, working very hard to sift through the incredible submissions for this fund. And look, I'm glad that you're the team, not me, because I couldn't choose. They're just so brilliant. But one of the things that I hear again tonight and have heard before is it's not just the winners that win, really. It's the feedback and the support that all of the applicants receive through the process. So they continue to improve their devices or their ideas till they've got to the point now where some of the winners tonight have been not successful in previous years. Yes, this was an idea of mine based on, but when I was in opposition, based on my knowledge of Cochlear and my great fondness for Cochlear and knowing how much it was transforming the lives of people. And I was very pleased, therefore, for one of the first devices that we funded was Saluda Medical Proprietary Limited, which won a grant in the first round. It's the world's first closed-loop system to bring real-time, non-medicated relief to sufferers of chronic back pain. And I'm pleased to tell you that just a month or so ago, the first implant was performed here in Sydney at Royal North Shore Hospital. This was after about 100 clinical trials, both here in the United States. And the fellow that had the implant had suffered from quite excruciating back pain for a number of years. And before the operation, he was asked by Channel 9, which reported this, what he scored his pain to be out of 10. He said 8 out of 10. Immediately after the procedure, he was asked the same question. He said 2 out of 10. So it was described by the media that covered it as a breakthrough. And I think that's how you could describe just about every device that we've been able to fund through this program. And I'm so excited to be here. I have to tell you, this is one of the most exciting nights of my life as the Minister for Health during the year. And I'm really thrilled that it's grown from strength to strength, and to see the value adding that's taking place, the other investors that come along. So that, for example, other successes in the early days, one was Elastogen Proprietary Limited, who received a $1 million Wellcome Trust Translation Award in collaboration with the University of Sydney, following receipt of one of our grants, and the Sydney Children's Hospitals Network and Kiko Knee Innovation Company, who both received a federal government accelerating commercialisation grant. That was a device that enabled children who needed bone surgery to have this device inserted, which grew with them as they grew. And I was just recently at the Health Innovation Awards, and other award nights, talking to some of the people from that lab there at the Sydney Children's Hospital, and they were telling me that it's really transformed their lives, and they've now got their own little laboratory thanks to another little bit of money we cobbled together, and they won an award that gives them a printer, so they're actually printing bone now. So look, I just find this whole thing absolutely stunning, and I want to thank you. It's a relatively small investment when you consider the health budget. The health budget in New South Wales this year is $19.6 billion for recurrent, another 1.2 or so for capital. And so it's a relatively small amount of money, but I reckon it's as important as anything else that we invest in, because it's really about the future. It's about giving patients hope, as it was that Saluda product was described, but it's also about energising, enthusing our young researchers, our universities, joining the dots between academia, between researchers, laboratories, and the clinical world, so that we end up with products that are not only going to be useful here in Australia and New South Wales, but internationally, and ones I hope through this program and through the other commercialisation programs that we can encourage to grow and be commercialised here in New South Wales, because this is the home of medical devices in Australia, and I'm determined that we should be growing that market and keeping our own at home, not without money from overseas, but doing as much as we can here to set these devices off on the right path. So that's all I'm going to say, except to say thank you very much to all of our expert panel and all the people who've submitted applications and the winners, and also to thank Adam. I should tell you that I now know that I was born on the 217th day of the year. I know how many native animals are killed by feral cats. I know that the Sydney Harbour Bridge moves, 180 millimetres every day due to a contraction expansion. And if anyone wants to know that and other facts, including things that are probably not mentionable in polite circles, about the rat, I think it was, or something like that. The flea. You need to buy Adam's World of Numbers. Thank you, Adam, and thank you, everyone.